All right, here we go. 7 weeks of a lot of intensive anatomy. The little girl that you're seeing in this picture, her name is Bethany, and she was the daughter of one of my students from a long time ago. And she was at an exhibit called Body Worlds. And I don't know if you've heard of it, but it's a really amazing exhibit. And the person is a anatomist and a French artist, and he plastinated a lot of people's bodies and posed them in different poses, like playing chess with each other, or there was even this one where you could tell it was supposed to be a dad and a mom, and the dad had a little child around his shoulders, and it was nothing but blood vessels. No bones, no muscle, just blood vessels. So Bethany loved this exhibit, and I love her enthusiasm looking at a skull here, and every time I look at it, I think, I hope my students are going to feel the same way as we go through and learn about bones and muscles and tissues, etc. To be fair, the first unit of lab unit 1 and lecture unit 1, really not that exciting. It's kind of boring. Anatomy is boring, just so you know. Everything is, this is this, this is this, this is this. That's what it is for the most part. But I also like to put in some questions that will test clinical concepts as well. And I find that that is very important to prepare you for physiology, but also many of you are going to pursue nursing. Am I right? How many of you want to pursue nursing? Okay, PA, PT, OT, dental hygiene. What am I missing? Anybody else?
Just
Dentistry, okay. Anybody else? A scientist? No. One time a person raised his hand and he said, I'm just here for fun. I said, why? He said, I'm a mechanic. I said, okay. And he had his own garage, very successful. Sean Mullet, I still remember his name. Quite the character. And I said, why are you here then if it's just that good for you? And he said, well, I want to learn about the human body. And after all, there are only 2 models. How hard could it be? And I thought, that's my guy right there. Mm-hmm. So let's go through Unit 1. And again, if you have your homework packet out, probably going to give you some answers. And also, this is going to propel us into lab for today. Go back and forth. You are here to learn anatomy, which really, like I said, means this is this, this is this, olecranon, etc., etc. You're learning morphology, the shape of the human being. We will be dissecting some sheep brains and sheep eyes, and I don't know about the status of the cats, but we might even be dissecting some cats, which is kind of fun, one of my favorite things to do. But I will also tell you a bit of physiology along the way as well. Again, my goal is to help you be prepared for the physiology course. I know what's coming your way, and I want you to be prepared. We also say in anatomy, with form comes function, meaning if you're learning the morphology, what something looks like, it also, if you look at it carefully enough, will give you an idea of how it works. What do we use it for? For example, when we get into the bones, you're going to learn about all these nooks and crannies and protuberances and tubercles, and all of those things have a description that goes along with them. And a lot of these are formed because of muscles pulling on the bone. And your bone models to that stress, that pulling stress, the tension. So with form comes function. We will be looking at cells today. We know, of course, that atoms can combine to form molecules. We're going from small to bigger. Molecules are components inside cells. And there are 4 macromolecules that I want you to know about, and also in your homework packet. The 4 macromolecules that you should be able to identify by description and also by their picture would be fatty acids, or actually phospholipids, which are made up of fatty acids, proteins, which are made up of amino acids. And I think there's like 12 to 15 questions in your homework packet I'm answering right now. Carbohydrates, which are made up of sugars, simple sugars, like glucose. DNA and RNA, deoxyribonucleic acid, ribonucleic acid. Those are macromolecules, and they are made up of nucleotides. Does anybody know the nucleotides? And this might be stretching way back into high school when you probably took a basic biology class. Go for it. Just name one if you don't remember all 5. Adenine, cytosine, uracil, thymine. Good. Which of those can be found in DNA?
Like thymine, and C and G.
So you're saying A, T, C, G. Okay. A lot of students omit uracil. Uracil can, I said can, be found in DNA. Should it be found in DNA? No. See, that's a different question. That's okay. Thank you for playing nicely. I was hoping someone would answer that. So uracil, when it is found in DNA, and it's not rare, it is a form of damage, and if not repaired, it can lead to a mutation. So uracil can be found. It should not be there, and if it is, the cell should rectify that. Should turn it back into, typically it's cytosine that it should be turned into. But now let's talk about RNA. What nucleotide is not found in RNA that uracil replaces? Uracil replaces thymine. I encourage you to answer, even if you are wrong. You want to know why that's so beneficial? Here's why. Because you don't want to be guessing on the day of the test. Now is okay to be wrong. Do you understand what I'm saying? Get it out of your system. Because then you're going to go, oh, I was wrong. Good. You won't do that again, will you? Right? You won't do that again. It's okay. So now we have our macromolecules and their monomers. Macromolecules are also known as polymers, meaning many little parts come together. Amino acids come together, bond through a peptide bond to form proteins, long chains. Fatty acids combine with a glycerol group to form phospholipids. Carbohydrates are formed from monomers, typically glucose is our focus. And then again, DNA and RNA macromolecules are made up of individual units that are linked together called nucleotides. All of those are found in cells. The most basic unit of life is a cell. Question: is a virus a living organism? It's not. Isn't that weird? We don't really, It does not satisfy all the 7 characteristics of life. I forget which of them it misses, but so even though it causes us so much grief, isn't it weird to think it just doesn't satisfy the definition of life? I think that still keeps me awake at night. It makes me kick the neighbor's cat, not my own cat. So then after that we have tissues, and the definition of a tissue is a group of cells with a common function. This week we will be learning about our 4 basic tissue types: epithelium, muscle, nervous tissue, and connective tissue. 4 types of tissues. Each of those 4 have unique characteristics, and they also have subcategories, which makes everything explode in anatomy. Organs. The definition of an organ is 2 or more different tissue types. 2 or more different tissue types. Bone is an organ. It has connective tissue. It has endothelium, a type of epithelium in its blood vessels that run through the bone. Has anyone here ever broken a bone? No? Well, good. When you break it, it's bloody. It's bloody. Even if it doesn't come through your skin, it's still bloody. And it also has smooth muscle in those blood vessels. So it is an organ, definitely. Your skin is an organ. It's the largest organ of your body. It has all 4 tissue types, all 4. And then organs can work together to create an organ system, like the cardiovascular system, your heart, and all the blood vessels that act like a conduit to transport the blood from the heart to the body, back from the body, back to the heart, and to the lungs, and back from the lungs to the heart again. That's all the cardiovascular system. It's different from circulatory system because then we add one more system to it, and that's the lymphatic system. Next, we have the organism, all the organ systems combined. And we are going to go through the organ systems step by step, or organ system by organ system. And the reason for that is typically in a 2-year school, they teach anatomy in an organ system fashion, meaning usually you start with tissues and cells, go on to bone and cartilage, and then you move on to muscle and joints and heart and blood vessels and lungs. They do it system by system. In medical school anatomy, they teach it in a regional fashion, which means back when I took anatomy with the medical students, we started on the back, and that meant we had to know everything in the back. All the nerves, all the blood vessels, all the bones, all the muscles, everything, everything, all at once for one region. It's pretty challenging, especially if you don't have an appreciation of the organ systems to begin with. Because then you have to figure out which organ system it belongs to, what is the function of that in the back for the purpose of the back. So this is a good start. If you're planning on going to PA school and take an advanced anatomy class, probably expect that it's going to be a regional approach, not a systemic approach. We are starting out for lecture unit 1, learning about the skeletal system and muscle, and from there we will move on to the circulatory system, respiratory, reproductive. Reproductive is last. I don't want to start out telling you about penises and vaginas and how best to use them until I get to know you a little bit better. Mhm. It is not always a G-rated class, by the way. There is language to anatomy, again, in the homework packet, and also a lot of the terms I'm about to give you are found in the lab hit list as well. We can't really use words like above. For example, your heart is above your stomach. Okay. When you're sitting up or standing. But when you're laying down, they're on the same plane, aren't they? So we have to use very specific words, and we have to have a universal starting position. Where is my patient's body in space? Because there is something called the anatomical position. That is always what we come back to. It is fundamental for any term I teach you in this class. You have to go back to this anatomical position. And the anatomical position is not this. That is not the anatomical position. The anatomical position is a person that is supinated. That means face up. Palms are facing forward. Hands are to the side. Feet are facing forward. So you're like this. And even if your patient comes to you in the emergency room looking like that, you still have to flip them in your mind's eye and put them in that anatomical position. And it's the patient's left, and it's the patient's right. And it might sound funny, but it still gets me to this day, because every morning my man blesses me. And we say our little prayers together, and he'll bless me, right? So, because we're both Catholic. And I do the same thing to him. I'm like, okay, gotta go. Gotta reverse it. So it's the patient's left and the patient's right. Many times someone has had the wrong kidney removed, the wrong appendage amputated. It has happened. And it is such a scare, like me today, pressing on the accelerator instead of the brake. It can happen. If a person needs to get rid of a kidney, or they're donating a kidney, or getting an amputation, the doctor, with many witnesses, will come in and say, which one are we amputating? And they will use a Sharpie marker, like X marks the spot type thing. I'm not making that up. I'm not making that up. Because it's so easy to do. And if you think about how tired doctors and nurses can get, fatigue and sleep deprivation is a real thing. There's a reason why some types of professions, they are mandated to take a break. Did you know that? Truck drivers, for example, is another one. They have to. Yeah, sleep deprivation is not going to be your friend in this class, because studies have shown if you are sleep deprived because you're cramming for the test all night long and you get 2 or 3 hours of sleep, you might as well show up to take the test severely drunk, because that is how your brain is going to be thinking. They've shown that. You need a good night's sleep before you take your test. When you are sleeping, your brain actually processes information. You need your sleep. Things will come to you in your sleep. I can even prove it to you when we get upstairs to the lab. I'll give you a little riddle to solve in your sleep. No cheating. Can't Google it. No. That ruins the experiment. So that is your anatomical position. Next thing we have upstairs in lab, we have Plain Jane. I love that model. And it's just a little tiny mannequin. And this mannequin has plastic sections going through her That's why we call her Plain Jane. So let me tell you about the planes that we are seeing in this picture. We have a transverse plane. If I were to cut you through your abdomen and separate your chest and head from your pelvis and your legs, that is a transverse cut. To put it in another way, I would be separating superior, everything above, superior towards the head, from inferior towards the feet. Sagittal plane, cutting straight down the middle, is a mid-sagittal plane, separating right from left. Mid-sagittal. There's also off-center. It's called parasagittal, or sometimes textbooks just say sagittal. And if they want you to know it's straight down the middle, they always say mid-sagittal. Parasagittal. Para means next to. For example, Vincent van Gogh. What did that crazy guy do? Have you heard of him? What did he do to profess his love for a young woman? Cut off his ear. That is a parasagittal cut. Yeah, he did. That's creepy. Guys, just send flowers. Don't send an ear. He had bad mental health issues. He was definitely manic. Let's see. We also have frontal or coronal. Technically not the same thing, but for us, we're going to treat them like they're the same. And that would be if I were to cut straight down to separate your face from the back of your head. Anterior separated from posterior. Front separated from back. That is a frontal or a coronal section. So let me do it again. Sagittal, separating right from left. Can be off-center, parasagittal, or mid-sagittal. We also have transverse, separating superior from inferior, top from bottom. Marie Antoinette, what happened to her? Who knew this was going to be a history class? They cut off her head, didn't they? That's a transverse section. For sure it is. Okay, then we have frontal or coronal, separating anterior away from posterior. When I was taking medical anatomy, we had to cut through our cadaver's skull. We had a female at my table, and we pulled away her face from the back of her head, and I got like inside, and I could see out her nostrils. I loved it. I'm a little bit morbid that way, though. I loved it. With our anatomical position, we now can add some language. Anterior, front, from posterior, back. Because we are bipeds, walk on 2 feet, our anterior can also be called ventral, which means belly. Our belly is on the anterior side of us. Posterior can also be called dorsal. Dorsal means back. Our back is definitely posterior. If we were a 4-legged creature, those words are not transferable. They're not synonyms. You can refer to anterior as ventral. You can refer to posterior as dorsal. But if you are going home and you're petting your dog or a cat, whatever you have, if you were to scratch your dog's head, that's anterior. That's front. If you were to scratch his rump and get the tail of the foot going, you know, like they do, That's posterior. But if you were to rub his back along his spine, that's dorsal. And if you were to give him a belly rub, that's ventral. But you're not here for veterinary science, so we're going to focus on the human, which means anterior and ventral are synonyms. You can interchange them, and posterior and dorsal are also synonyms. Next, we have proximal and distal that I'd like to cover. This one is a little challenging. It refers to the point of attachment of your appendicular skeleton, your limbs. That's your appendicular skeleton, to your axial skeleton, your main frame. The closer the attachment to the main frame, proximal. Farther away, distal. The wrist is distal to the elbow. The elbow is distal to the shoulder. Get it? Notice I had to give you two areas for you to compare. I can't ever say the elbow is distal. To what, Kara? The brachium? The shoulder? What are you? Distal. I need to give you two things to compare. Your nose is anterior compared to your occipital bone. I have to give you two terms for you to compare and contrast. Your ears are lateral from your eyes. They are away from the midline. Lateral, away from the midline. Medial, towards the midline. Towards the midline. These are directional terms, and they will be tested on your lab exam, and we will most certainly practice in lab what your lab exams are going to look like. Don't worry, you have a lot of involvement in designing them. We also have superior versus inferior, superior towards the head, inferior towards the feet, superficial versus deep. Superficial means closer to the body surface. Your skin is superficial to your bones. Your heart is deep to your thoracic cage, your ribs. Deep, more internal. Superficial, coming more external. Prone versus supine. Prone, face down. Supine, face up. But we also have pronation and supination as actions, especially in our antebrachium. Antebrachium is your forearm. Ante means before. Forearm, antebrachium. Brachium is here, the humerus. When people say to me, I broke my arm, and then they show up with a cast down here, I'm like, I thought you said you broke your arm. I did. No, arm. Arm. This is arm. This is brachium. You broke your brachium, or did you break your antebrachium? You know, we become very snobby in this class because we learn the proper terms. The book that I get a lot of my charts from, and we'll talk about books upstairs. I want to make sure I'm not going over so you all have your break. I'm not. Has a lot of great tables that I think if you're the person that likes to make flashcards, here is one that's already made for you. I think you have better use of your time than making flashcards. The only time I do recommend it is when we have to learn origins, insertions, and actions for your muscles. But until that time, it's good old-fashioned studying when you're in lab. That's your opportunity. And then for lecture, it's your homework packet. Your homework packet is your friend. It's your best friend in this class. We are going to go through regional anatomy, especially if we look at our hit list. I'm going to go through a few of them with you right now. Okay, so coronal, we did that. That's a plane, transverse. Mid-sagittal versus parasagittal/sagittal. Oblique means at a slant. We did go through anterior, posterior, dorsal, ventral, superior, inferior. Caudal means towards the tail. A lot of these terms that caudal and rostral is more towards the front, refer to embryology. I don't really use rostral too much. Cranial, towards the head. Caudal, towards the tail, as in your tailbone. We did medial and lateral, deep, superficial, proximal, and distal. Let's go through some regional anatomical terms shown up here, but I will also try and show you on myself to the best of my ability. Abdominal. Feel free. Play around along with me. Abdominal. We have antebrachial. Ante, before the brachium. We have antecubital. When you get your blood drawn, they are going into your antecubital fossa to get that vein. We have auricular. Auricular means ear-shaped. There are going to be a few places in bones especially where you're going to see an auricular structure, which means it's going to be ear-shaped. We have axillary. Did all of you put deodorant on your axillary fossa? Right? Or as my sons would always call it, Mom, we need more pit protector. I'm like, you need some axillary fossa protector? Yes, you do. I can smell you from here. Brachial. Brachial. Buccal. Because right here, you can remember it, you have your buccinator, a muscle in your cheeks, which helps compress the food and keep it more centered so you can chew it better and taste it with your tongue. Buccal. Buccinator is right here. Buccal. Calcaneal. The heel. The calcaneus is the bone, one of your tarsals. That is our heel. Carpal. Wrist. How many of you wear a wrist watch? You do? You wear it down here? Because that's where your wrist is. I think most of you are wearing it on your antebrachium. So do that in the future. Has anyone seen my antebrachial watch? Oh, I have fun in my head. Cephalic. Again, head region. It's just another term. There's my joke is there are 5 words for every structure in anatomy except for when there's 7. That's my joke. So cephalic means head area. Cervical, right here, your neck region. This is where you would have your 7 cervical vertebrae. 7 cervical vertebrae. Vertebrae is plural. Vertebra is singular. It's a weird thing about anatomy as well. Usually, if we want to make it plural and the word ends with an A, we add an E. I know, we don't add an S. We don't say vertebras. Vertebrae. Coxal. Your coccyx. Tailbone area down here. Has anyone broken their coccyx? Not on purpose. Wasn't even me falling on something. Back in high school, I played soccer for my school. And I didn't grow until I was a senior in high school. I was little. I was the second smallest in my class, behind Lori Gentilini, because we always had a line up according to height for pictures. And even though I was small, I was fast. And we were playing this Amazon team of Amazon women. I mean, they were just, I don't know what they fed those girls, but I came in and did a clean slide tackle and won the ball and passed it up to my front line. And the girl, I didn't even trip her, was totally clean through and through. Like came in, slid, got the ball, stood up, boom! It's beautiful. And no, we didn't score. But we only had one ref. And in high school games, you're supposed to have two, one for each side of the pitch. But we only had one that day. Well, this poor ref was running back and forth, of course, watching the ball and what's happening. So when I passed the ball up, and everyone, even the fans, are looking where the ball's going, right? That's what you do. This Amazon picks me up by my brachium and throws me on the ground. I landed right on my coccyx, felt it and heard it snap. There's no cast for that. Do you understand? There's no cast. Yeah, it hurt. The only person who saw it was my mother, who was ready to beat up this Amazon. So that's your coccyx, coxal region. Cranial, again, head region. Crural is your calf. That's where you have your crural muscles, or gastrocnemius and your soleus. Deltoid. My deltoid still hurts, even though it was 3 weeks ago when I got my pneumococcal immunization and also, and I got a tetanus immunization because I thought if I have a cat, better get that. Digital. Digits. Fingers and toes. Toes are also digits. Femoral. That's your thigh. Your femoral bone is in your thigh. Fibular. You have two bones. In your lower skeleton. You have a fibula, which is lateral, and a medial bone called your tibia. Fibular, lateral. You can actually see part of your fibula when you look at your outside ankle. That is your lateral malleolus. That's what it's called. Frontal. This is your frontal bone. Gluteal. Little fanny. Hallux. There's hallux, and later on there's pollux. I want to address both of them now. Hallux. Hallux is your big toe, and pollux is your thumb. Here's how you can remember that. Let's take a poll. Who wants to have a nice break so you can go get something to eat or some coffee? Poll. Pollux. Good? Take a poll. Well, when it's time for a break, your big toe is going to help you walk down the hall. Alex? I'll be here all 7 weeks. Unless you fire me. Inguinal and lumbar. Inguinal region. Inguinal. Your inguinal canal is found right here. For men, this is where their testes drop out from their abdominal cavity to go into the scrotum, or as my boys call it, the NAD bag. And Women also have something that comes off of their uterus. Weird to think, ladies, that your round ligament coming off your uterus travels through the inguinal ligament or inguinal canal before it turned into a ligament and anchors into your labia majora. Weird to think your uterus is anchored outside. It is. We're going to have fun this semester. Lumbar region. You have 5 lumbar vertebrae. Down here, 5. Mammary. Manus. Hand. Manus. Hand. Mental. It's weird. Mental. We think mental like brain, right? No. So when you're like, are you going mental on me right now? Nasal. Nose. Occipital. Occipital bone back here. Occipital. Olecranon. Now you see it. Now you don't. Now you see it. Now you don't. Oral. Orbital. Palmar. Pectoral. Same general area as mammary, isn't it? Pectoral. Pelvic. Your os coxae. Your pelvic bones are also called os coxae. Perineal. I'm not going to show you that. Pes, foot. I always thought it was candy, but no, it's foot. Pes. Plantar, the underside of your foot. I always think of it as I point my toes to the plants in the ground. That is a type of plantar flexion. Popliteal, the back of your knee. Popliteal. It's all squishy there. You want to know why? Full of fat. Tons of fat back there. Probably my favorite thing when I'm doing cat dissection is just picking out all the fat from their popliteal region. Pubic region. Pubic. You have a big fat pad right here too. It's called your mons pubis. And there is a pubic bone, one of the 3 of your os coxae. Radial and ulnar anatomical position. Your radius is lateral. The radius is on the thumb side. Ulnar is on the pinky side. I think PU. Pinky, ulna, PU. Sacral and scapular. Sacral is a little bit higher than your coxal area. Sacrum, right here. You have about 5 to 6 bones that are fused together to create your sacrum. Actually, it's 5. Scapular. There's a bone back here. That's your scapula. So posterior to your pectoral would be your scapular. Sternum. By the way, the word sternum, when we get to our bones, is never going to be an answer choice. The sternum is created of 3 separate bones. Altogether, it is the sternum. Sural. Sural. Oh, you know what? I screwed that up. Let's go back. Sural is the back of your calf. Crural is the front of your calf. Got that confused? Tarsal. Tarsal bones are in your foot. You have the calcaneus, you have the talus, you have 3 cuneiforms, you have a cuboid, you have a navicular. That's all coming to you in Lab Unit 2. Thoracic, as in thoracic cage. Tibia. Tibia is on your big toe side, your hallux side. Fibula is on the lateral side. Umbilical. Umbilical. And then vertebral, all the way down your spine. Vertebral. Okay, how are we doing on time? We are at the end of class. We've done a lot so far. How about you please take a break and